Hello, everybody. I'm Dr. Mikhail Kosiborod, and this is Recap. We're going to concentrate on some of the key presentations at the European Society of Cardiology 2023 that have to do with management of diabetes and cardiovascular disease. The first one that I'll highlight is the STEP HFpEF trial. Now, this trial looked at a very important question: is targeting obesity the therapeutic strategies that can provide significant benefits in patients with heart failure and preserved ejection fraction. Patients with type 2 diabetes were excluded from this trial because there is a sister trial currently going on, specifically concentrating on patients with HFpEF, obesity, and type 2 diabetes. And in this trial, 529 patients with HFpEF and obesity were randomized to either semaglutide 2.4 milligrams once weekly or matching placebo. Semaglutide produced significantly larger improvements in symptoms and physical limitations as measured by the Kansas City Cardiomyopathy Questionnaire, which is the gold standard of evaluating these measurements. This is the largest benefit ever seen with any pharmacologic intervention on HFpEF. It also produced, not surprisingly, greater weight loss, but importantly, there were other benefits as well. There was an increase in exercise function as measured by 6-minute walking distance and reduction in inflammation. How much of these benefits were driven by weight loss versus other effects of semaglutide? And it's a difficult question to answer and tease out, but there are certainly some signals suggesting that it's more than just weight loss. One of these is significant reduction in N-terminal proBNP or NT-proBNP, one of the exploratory endpoints in the trial. And while the number of clinical events was low, they were favorably distributed to semaglutide versus placebo. So out of 13 adjudicated heart failure events, only one occurred in patients treated with semaglutide and 12 in the placebo group. So a really fascinating area, and there will be more data coming. There is also a trial with tirzepatide, a dual GLP-1 GIP agonist called Summit, which is currently ongoing as well in a very similar patient population. So more to look forward to. We're now going to shift to the European Society of Cardiology guidelines for management of diabetes and ASCVD. And there were a number of changes that need to be mentioned on top of what already was in the 2019 guidelines. And just to hit some of the highlights, there is a lot of emphasis about screening for cardiovascular disease in patients with diabetes, screening for diabetes in patients with cardiovascular disease. And in terms of therapeutic changes, one of the key ones that I'd highlight is the recommendation to potentially consider combination therapy with GLP-1 receptor agonists and SGLT2 inhibitors in patients with diabetes and ASCVD. There is a relatively small change in the language, but it's actually a big difference saying GLP-1 receptor agonists and or SGLT2 inhibitor, acknowledging that combination therapy may be appropriate in a number of these patients that are at high risk because of established ASCVD in the setting of diabetes. The last one I will mention actually is in the heart failure guidelines, and that's a very high level, class 1 level recommendation for prevention of heart failure in patients with diabetes and chronic kidney disease for finerenone, a non-steroidal mineralocorticoid receptor antagonist based on Fidelia and Figaro trials, given the significant reduction in heart failure hospitalizations that were seen in the pooled analysis of those two trials with finerenone versus placebo. In terms of our next highlight is the data from CLARE outcome trial of bempedoic acid versus placebo in statin-intolerant patients with either established ASCVD or high risk. So this was now a sub-study looking at patients with diabetes, pre-diabetes and normal glycemia, stratifying by those subgroups, and a large proportion of patients had diabetes, about 45%, with about 40% having pre-diabetes and the rest normal glycemia. And the bottom line is that patients with diabetes had a similar relative risk reduction in both MACE-4 and MACE-3 endpoints, very significant reduction, 17 and 20% respectively. And those relative risk reductions were consistent in individuals with diabetes as compared to those that didn't have diabetes, but they had higher absolute risk. And so the absolute risk reduction was even larger in people with diabetes. There was also another part of this analysis looking at the effects of bempedoic acid on new onset diabetes and also on hemoglobin A1C changes in patients that did not have diabetes at baseline. The bottom line message here is that there was no impact of bempedoic acid on new onset diabetes. It was similar to placebo. and there was no effect on hemoglobin A1C levels either at 12 months or at the end of the study. So reassuring data in terms of any lack of increase in A1C or progression to type 2 diabetes. And the last study I will highlight is a World Health Organization-led meta-analysis of 3 different trials of SGLT2 inhibitors in patients hospitalized with COVID-19. In these trials, somewhere between 25 and 50% of patients had type 2 diabetes, but the meta-analysis did not find any benefit of SGLT2 inhibitors on the primary endpoint of death at 28 days, all-cause death at 28 days, or any secondary endpoints. But another important part of this meta-analysis, highly relevant for management of people with type 2 diabetes as well as heart failure and CKD, and that is that there were no new safety signals identified in the meta-analysis. And the number of serious adverse events and serious adverse reactions were balanced between SGLT2 inhibitor group and the comparator, and the cases of ketoacidosis were extremely rare. So I think the clear clinical implication here is that if the patients are getting SGLT2 inhibitors for type 2 diabetes, chronic kidney disease, or heart failure, there is no compelling reason to discontinue them routinely in the setting of acute hospitalization. And there you have it. That's recap. And I'm Dr. Mikhail Kosiborat, highlighting findings and key analysis at ESC 2023 on diabetes and cardiovascular disease.